Welcome back to After Surgery. What the
Could have been 30, could have been a G. Should've never snitched, why you take it to police? Started looking at you funny when you walking down the street, looking at you like food, trying to see what they can eat. Me, I'm like Wallow and Gilly with his game.
I'm, of course, Dr. Benjamin, and today we're delving into something pretty much every plastic surgery cosmetic patient experiences at one time or another, and that is bruising. Bruising after surgery is extremely common, and there's different levels, and also what complicates things is everyone kind of bruises differently. When we operate, even with precise technique, especially with liposuction, tiny blood vessels in the area and the tissue can break apart, and they can leak out some of that blood. You know, ideally it should be just a small amount, because if it's a very large amount, you get what's called a hematoma, and that's a big deal. Sometimes you need to go back to surgery to get that evacuated or cleaned out. But typically you'll have just small blood vessels leaking some of that blood out, and it's a process for the body to clear away the little blood vessels that have been leaking around. The process that you usually see after bruising, you know, is typically you'll have like a dark area, and it's just like a bruise, just like any other trauma that you'd have to the soft tissue. So you'll have like a purplish area. It should be a light purple ideally, nothing dark. The skin and the soft tissue should always be soft, guys. If your bruising is so extensive that that area is hard and firm, you may have a problem. You got to see your plastic surgeon and evaluate that. So typically it's a small area, and then you'll see over the next couple weeks that that actually transforms. It turns into a greenish, sometimes a yellowish, and then finally fades away. And ideally, that yellow should fade away completely. Otherwise, you may get what's called a hemosiderin deposit. So that's literally the iron in the blood that gets trapped in that dermal level. And if it stays there for too long, you may need a laser treatment or something actually treated to make it go away completely. Most patients typically will notice the bruising sort of peak around day like 3 to 5 after surgery. And like I said, it usually looks darker before it gets lighter, with some of those color changes from purple to blue to green to yellow, and then completely back to normal. Now, what can you do to help minimize the bruising? Well, the surgeon does a lot of that. So that means hemostasis, making sure everything's nice and clean, especially when those implants go in. And in terms of liposuction, I use a lot of what's called tumescent solution. That's part of that rapid recovery technique that I do for all my breast surgery, but I use that for liposuction especially. And then of course, the garments, guys. Tight fitting garments. Shouldn't be too tight, but should have nice compression. I typically add some nice, really condensed foam. That compression is what minimizes that bruising. Typically, all my patients will receive what's called an arnica supplement. It's an over-the-counter supplement. Sometimes they make it in a pill form that you take for a week. They make it in a tea form. And then after that, you can use a cream. There's an Arnica Montana cream that you can use that'll help minimize a lot of that bruising that you're seeing in the early post-op period. Now, one thing patients don't typically expect is how the bruising can travel. Remember gravity, guys. We're all walking on Earth, right? So gravity is going to pull everything down. So although you've had like liposuction in your armpits, for example, you may notice some bruising even in the top part of the abdomen, lower part of the chest. That's because gravity's pulling that bruising down. Now again, that skin and soft tissue should always be soft. So this doesn't mean that anything's necessarily wrong. It's just how your body's healing, during that process. You should be seeing your plastic surgeon quite often in that early post-op period so they can monitor your bruising, make sure that it's improving. Bruising becomes a concern when it expands rapidly, when it's extremely painful, when that soft tissue is unusually firm. It's typically paired with significant redness, fevers, you're not feeling well, you're super sweaty, all those are bad signs. So if it looks dramatically different, especially if you're several days out from surgery and it's actually worsening, that's a surefire way you gotta call your plastic surgeon, make sure you're scheduled for follow-up.